Cervical screening is moving to every 5 years in England. This is now in keeping with what's already been happening in Scotland and Wales. Understandably, many of you have concerns and worries about the smear test moving from every 3 years to 5 years. I also am a 41-year-old woman. I will still need smears for a very long time. And like you, I have the same fears and worries. So I'll try my best to show the robust scientific data behind this decision and why cervical screening is moving to a more individualized approach whereby there'll be a greater uptake of the test than we have now currently, even though we operate every 3 years in the missed groups and for those who don't attend for their screening appointments, because as we know still currently as it stands, not everybody sadly attends their cervical screening. Now, over the last 30 years or so, our understanding of how cervical cancer develops has massively increased. We use the cervical screening test not to test for cancer, but to check for HPV. We also now have the HPV vaccine rolled out since 2008 in the UK, which means we've been vaccinating 12, 13-year-olds, boys and girls. Therefore, our understanding of decreasing the high risk, so the high risk HPV, has significantly increased over the last 17 odd years or so since the HPV vaccine has been rolled out in schools. That actually in February 2025 in Scotland, there were 0 cases of cervical cancer picked up. And I did a video about this at the time, highlighting how amazing it is that a vaccine has the potential and is on the trajectory to eradicating cervical cancer. Finally, we also now use a slightly different test for primary HPV testing, which is a more sensitive and far more accurate than the previous cytology test that we used to use. Now, the cytology test would pick up abnormal cells as well as HPV, but the new primary HPV test, which looks for low risk or high risk HPV sampling, this method is actually 20%. Yep, 20% more accurate than the previous old samples that we used to do when we used to do cytology testing for cervical smearing. So this more accurate HPV test allows us to offer a more individualized, personalized approach by finding out who actually needs to have regular testing and who can wait for a little while because they're actually not that high risk. So by finding out who's at high risk of developing the cervical cell changes due to high risk HPV, that over time, if left untreated, could lead to cervical cancer. This was backed up by one of the large scale studies, the Artistic trial, which was done across England. This trial showed that because HPV primary screening is so much more sensitive, those that don't have HPV could be screened less often. Research has shown that if you are HPV negative, you are very unlikely to develop cervical cancer within the next 10 years. And this research has been looked at across King's College Hospital and is also backed up by the European regulatory bodies as well. We have found that screening every 5 years instead of every 3 years was just as safe to prevent just as many cervical cancers. Now, it's important to know that the change to these regulations won't come in very quickly and also won't apply to those that are already deemed high-risk HPV and who are already at a greater risk of changes to their cervical cells. And they will still continue to be checked more regularly and have their own individualized plan. So for you, if you're already high risk and you already had any changes of cervical cancer or you've had cervical cancer in the past, please do not worry because things won't change for you. From July 2025, not every 25 to 49-year-old, so that's me included, will move to the 5 years automatically if your test result is negative. But if your last test was taken within the last 5 years and showed a HPV positive result, you will still be invited for screening in 3 years' time so that we can continue to monitor your HPV status. Again, it's not going to be rolled out instantaneously for everybody because we're trying to make it more individualized depending on your HPV test. If you test negative for HPV, and that is in the next screen as well, and you're still negative, then you'll move to a 5-year screening test. If you test positive for HPV, that doesn't mean you'll get cervical cancer, but it will mean that we'll need to monitor you closely. So if HPV is found in the sample that we've done for you and we've checked it and there are no cell changes, you'll be invited, as the regulation at the moment, for screening again in 1 year's time. And if cell changes are found alongside your HPV, then you will be referred directly to hospital clinic for colposcopy to check the cervix more closely, and that's what currently is happening at the moment. Some of you have equally been worried about false negatives with the HPV sampling. As I explained earlier, the new way of testing, not for cytology, but for HPV, is much more accurate. So the sample sizes that we've looked at has massively reduced the chances of false negatives. As always, new changes are always worrying, and we're always learning consistently, but we're getting better with our technology and understanding cervical cancer. The Eve Appeal have some brilliant advice. Please check that and I'll tag them. If there's any questions,